Hi everyone! How to tackle the toughest NCLEX questions, strategies for success. What's going to be on your NCLEX? You better believe it's going to be those tough questions. Today we're going to talk about how to tackle the toughest NCLEX questions. Stick around. Read carefully. Emphasize the importance of reading the question stem slowly and thoroughly to avoid mistakes. Identify key phrases. Highlight how to spot important phrases such as first, best, or most important. Look for clues. Show how the question often gives hints about the answer. Example question. A 60-year-old male with a history of chronic obstructive pulmonary disease is admitted for an exacerbation. The patient is on oxygen therapy at 2 Min v nasal cannula. His oxygen saturation is 88%, respiratory rate is 28 breaths min, and he appears anxious. His ABG results are as follows. pH 7.32. PaCO2 55 mmHg. PaO2 60 mmHg. HCO3 28 mg/L. What is the nurse's most appropriate next action? A. Increase the oxygen flow rate to 4 Min. B. Administer a bronchodilator as ordered. C. Notify the healthcare provider about the ABG results. D. Reassess the patient's vital signs in 30 minutes. Correct answer. B. Administer a bronchodilator as ordered. Rationale. This scenario requires you to evaluate the patient's ABG results and clinical status. The low oxygen saturation, elevated PaCO2, and respiratory acidosis indicate that the patient is experiencing respiratory distress. Administering a bronchodilator would help relieve the bronchoconstriction and improve ventilation, which is the priority intervention. Increasing the oxygen flow rate could worsen hypercapnia in a COPD patient, as they rely on low oxygen levels to stimulate breathing. C. Notifying the healthcare provider is important but not the immediate priority. Interventions to stabilize the patient should come first. D. Reassessing the patient in 30 minutes is not the best option as the patient needs immediate intervention to improve their oxygenation and ventilation. Eliminate incorrect options. Elimination strategy. Discuss how eliminating obviously wrong answers can help narrow down the choices. Look for extremes. Teach viewers to be cautious of extreme words like always, never, or only, as they are rarely correct. Example question. A 60-year-old male with diabetes and hypertension is admitted with chest pain. His ECG shows St. elevation and the healthcare provider orders a nitroglycerin infusion. The nurse notices the patient's blood pressure is 88/56 mmHg. What should the nurse do next? A. Administer a dose of oral nitroglycerin. B. Decrease the nitroglycerin infusion rate. C. Increase the patient's fluid intake. D. Notify the healthcare provider about the low blood pressure. Correct answer. B. Decrease the nitroglycerin infusion rate. Elimination process. Option A. Administering oral nitroglycerin would lower the blood pressure further, which is unsafe. Option B. Decreasing the nitroglycerin infusion rate is the best action to prevent further hypotension while still managing chest pain. Option C. Increasing fluid intake might help, but the immediate priority is adjusting the nitroglycerin infusion. Option D. Notifying the healthcare provider is important, but not as urgent as adjusting the nitroglycerin infusion to address the low blood pressure. Apply nursing knowledge. Focus on nursing principles. Guide viewers to apply evidence-based practices, protocols, and patient care standards while answering. Use pharmacology knowledge. Demonstrate how strong knowledge of pharmacology can help, especially when questions involve medications or side effects. Practice with NCLEX-style questions. Show sample questions. Present challenging NCLEX-style questions with detailed rationales for each answer choice. Walk through the explanation. Break down how to analyze the question and eliminate wrong answers. Apply test-taking strategies. Mention strategies like marking questions for review and moving on if you're stuck. One final note about those tough questions, it's going to come down to nursing school. You've been studying for this test since you started nursing school. You know the material. You just need to make sure that you're applying it correctly. Thank you so much for DY. Go ahead and download your free NCLEX study guide and get started on your NCLEX journey.